Hello everyone, hope we're all doing well. Today's speech is to teach you on the importance of CPR and how to do it effectively. Got a scenario for you. You're out at dinner with your family and the man or woman at the table next to you suddenly grabs his or her chest and falls to the floor. What do you do? Well, I know what I would do. I would begin CPR. Now, being in the medical field for 10 plus years, I've had the opportunity to not only teach CPR, but as well as perform it on at least, I'd say, 100 or there more of patients. Okay, so what is CPR? What does CPR stand for? CPR stands for cardiopulmonary resuscitation. When do we use it? We use it during a cardiac arrest. Now, is a cardiac arrest the same thing as a heart attack? No, it's not. A lot of people get this confused. A heart attack is when a portion of the heart dies, there's no oxygen to that portion of the heart. Cardiac arrest is when there's an electrical malfunction and the heart stops pumping blood to the organs. Let's take the heart for a second. Now, the heart is the strongest muscle in our body. Like I just said, it pumps oxygenated blood to all our vital organs. If it cannot do this, we get no pulse, we stop breathing, and death is imminent. Okay? Now, CPR. Can anybody do it? Sure. There's a study done by the American Heart Association that says 70% of bystanders who performed CPR actually did it on the spot, on the phone, getting instructions from the operator they were talking with at 911 dispatch. So, yes, we all can do it. What are the signs and symptoms? Like I mentioned, loss of consciousness, no pulse, they're not breathing, sudden collapse. Okay? So, let's talk about the steps more in depth. Remember, CPR is important. This is Bob. You should meet Bob real quick. He's going to be part of our demonstration today. Okay? So, let's think about that scenario. We reach the patient. First thing we want to do is make sure our scene is safe, because a lot of times people don't die in a safe environment. So, scene safe, scene safe. Next thing you want to do is you want to check the person's level of consciousness or responsiveness. Sir, ma'am, are you okay? Are you okay? They're not responding. What do you do next? Activate EMS or call 911. Calling 911 is the best chance for this person's survival because EMS crews will be en route to help shortly. Okay, we've done that. Our scene is safe. We've checked responsiveness. We've activated EMS. From here, the new standards say we need to begin compressions. How do we begin compressions? Well, we find the imaginary nipple line. I say imaginary nipple line because if this is 75-year-old grandma, her nipple line might not be at the same place that Bob's here is. So, we find the patient's armpit. We draw a line, imaginary, to the center of the chest. One flat palm down. The other hand on top of the flat palm. Interlock our fingers, and I do what's called tip at the hip. From here, we keep our arms straight and we tip. Now, this step in the process, we're going to do 30 compressions. Once we do 30 compressions, our next thing to do, if you feel comfortable, is to give 2 rescue breaths. So you tilt the head back, blow in once for about a second. You should see chest rise. Blow in again. Chest should rise again, and then you go back to your compressions. Remember your hands in the center of the chest. Imagine nipple line, elbow goes on top, and we tip at the hip. Now we're going to continue compressions until EMS arrives. The depth of compression is important. You want to do at least 2 inches, and you want to do it anywhere from 100 to 120 times per minute. If you do not feel comfortable with doing the rescue breath portion, you can actually do what we call hands-only CPR. I actually did it on a woman on the side of the road, and it does work. I just open up her airway, and you just compress until help arrives. Now let's retrack everything. CPR, it's important because why? It saves lives. 40% of people who've had CPR performed before the ambulance crews arrived have survived. Remember that 70% of people had no idea how to do CPR. They were instructed on the phone via operator. Remember your quick and easy steps. Scene safe. Check responsiveness. Activate EMS. Begin compressions. Do 2 breaths. And continue compressions till help arrives. Okay? I would like for you to, when you get home, or if you're at home, practice on a pillow. Teach a friend. Teach a family member. Because CPR is important and it does save lives. Thank you for your time.